Good evening, Town of Littleton. This is the Littleton Board of Health meeting for November 12th, 2025. We are currently waiting for our Director of Health to show up. He was out doing some inspections this evening. So I would like to pause the meeting until our Director of Health comes into the meeting. So I'm going to put the meeting on an official pause. That's not going to pause the recording, but it will pause any and all of the discussions that are in the meeting. So I appreciate people's time, and we'll start the meeting as soon as our Director of Health comes in. Thank you for your understanding.
He's here.
Thank you, residents of Littleton. We are now coming back into our meeting. Francis, our Director of Health, has come in from a days long of inspection. So we are going to let him gather his moments for a second to let him know that he is here and everything is good to go. And we are ready to start our first item on the discussion at 7 p.m. is the tobacco regulation amendment. So if everybody would turn to their packets, Francis, if you wouldn't mind leading our discussion.
Sure. So at the last meeting, just to recap, we looked at a lot of language updates essentially to the tobacco regulations since 2018 to a new model reg for 2025. We did have a series of questions that we were looking for DPH and also the Leominster Tobacco Alliance to answer. We have not received a response yet. We were anticipating receiving them for tonight. So essentially in the packet is just a cleaned up without all the red line version, but we don't have any of the answers to the questions. So the discussion won't be very substantive.
Understood. I would like to understand, we do have several colors in there. We have a red section, like on page, the page 6 has a red section. And then there are several green sections and highlights, and some teal sections of highlights and things like that. I was just wondering if we could have an understanding of what each of those different things mean.
Sure. So turquoise would be items that are being further researched, reaching out to third parties to find out answers. Green is going to be kept for the public hearing that will happen after this, where the Board of Health will have to make specifically local decisions. And they have the ability to do that. So that changes from town to town is not common language. Yellow was updated language. I think most of those are gone. And red line, I think there's only one red line, and it was a question of the definition.
There's a large section of red line that is in 224-21020. There's an A and an option B.
Oh, yes. So that, I believe so Kevin Baker said that years ago, the Tobacco Alliance met with the Board of Health at the time, and they actually made a determination from option 1 or 2 at the time.
Okay.
So we're waiting on the Tobacco Alliance to answer that question.
All right,
but the board can change these if they want. Yeah.
Okay, roger that. Okay. Does anyone have any other questions surrounding those gentle explanations? So that way we can at least read it offline and be ready to discuss it at our next meeting, if that's okay with everybody here at the board. Does that make sense?
Yeah, we went through it pretty exhaustively last night. Like Francis mentioned, we don't have any of the yellow sections left because we basically said, yes, go ahead and adopt this latest state law. Great.
Mm-hmm.
Or the latest DPH regs. Great.
Yeah. Okay.
So yeah, it pretty much is just waiting for the clarification on the turquoise stuff. And like you just pointed out, that A-B choice that we're saying, well, we think we already have made that choice between A or B. So let's
Yeah.
at least start with what we currently are doing, and then we can debate as to whether we want to change it. But if not, let's stick with the way we've been doing it for some time.
Yeah, roger that. Okay. And yeah, that was my apologies for missing the last meeting. I did watch it, but I was not remembering everything that was there that you guys had discussed. So I appreciate that for the gentle knock on the noggin to remember what was there. So thank you.
Yeah, I don't think there was a ton of debate that we had that we needed to come back to. So anticipate we'll get it cleaned up. Yeah, Francis, get it cleaned up. Let's hopefully get the Tobacco Care Alliance answers before our next meeting, which is going to be a month away anyways. And then we would expect, because of our meeting schedule, a public hearing would be in January.
Okay. Which I think is the last time we had some sort of meeting that went over the tobacco regulation. I think was in the January timeframe the last time we talked, or at least in the middle of winter. Let's put it that way. Okay.
Awesome.
Yeah. All right. Dan, do you have anything to follow up on? No? Okay. All right. So then without any other further discussions, I guess we can close this discussion and just hold it for our next meeting. So that would be good. All right. The next thing that we have is the Charter Review Committee. I was asked on a very short turnaround to come up with a presentation about what the Board of Health actually does. And
Mr. Davis.
Yes.
I know it's not a public hearing, but should we be jumping ahead on the agenda schedule?
It says Charter Committee Review for 7:20.
For 7:20, that's what I'm saying. It's 7:07.
Oh, you're right. Thank you for the point of order, and in case somebody wanted to come in, so I appreciate slowing.
I mean, I assume it's not as critical for a discussion point.
Nope. All good. All good. I appreciate that. We can go right to our administrative matters with meeting minute approval, if that's okay with everybody. All right, so let's go down in our packet and let's.
It is, except we don't have enough people for either of them.
And I was just going to ask that with not enough people here for that, we can't approve either one of them. So this is great. So why don't we go to the ID decision support tool? We can talk about that, right? Yes.
Sure thing. I can give you an update. I'm not going to show the tool because I have some work to do on it. But as I presented last time, my data sources have all kind of gone out the window. The state has started posting vaccination immunization data, so I'll be able to start showing that. They had held off until they had enough data to actually start presenting something, so I'm a little bummed that it took until the start of November for them to show any data whatsoever. So Littleton is currently for COVID vaccinations at 12.4%. And we were discussing a little bit earlier, the best town in Massachusetts is actually at 25.2%. So you're seeing globally low numbers for COVID vaccinations right now. I'll point out that most of our neighboring communities are very similarly in the east of us. It's kind of 13 to 14%. North of us is kind of like less than 10%. So not very strong numbers on the COVID vaccinations. And then on the influenza vaccinations, we are at 31%. Similarly, that kind of the state best right now is a little over 50%. I think those are pretty low numbers. I haven't looked back historically to see kind of where we are in the season and how high our numbers usually go. But knowing that we've already had clinics in town, those aren't exactly numbers that blow me away. The good news right now is that the risk of influenza for the state is still low. So we're kind of early in the respiratory illness season, but invariably that the season will be here. And I'm not sure how well prepared we are for that. So I'd love to see some better vaccination numbers than 12% and 31%.
Agreed. I would really love to see. How did our second vaccination clinic go, by the way, Francis?
We had 152 people, I believe.
Nice.
which in comparison to last year's middle school clinic around the same time, it's a slight increase. Um, I think it was about 40% received both shots. So that goes in line with what Matt was saying for the state.
Yeah.
I mean, this year, I think it's notable that, so this year we had 2 clinics for the first time instead of having just 1. So obviously our numbers doubled because our first clinic also filled up. And then we increased capacity in our second clinic. And then we're already talking about a third clinic, but we think it's too late in the season. So next year, with our ducks in a row, we're thinking about doing 3 clinics. And I think we can boost our numbers higher.
Yeah, that sounds really effective. I understand that it might be kind of like, a little late in the season to get it. But, encouraging everybody in the listening audience to definitely go see your healthcare provider if you're interested in taking care of it. And, getting the appropriate vaccinations for you is definitely one of those decisions between you and your healthcare provider. And that's a really important thing. Okay, so Dan, do you have any questions or comments?
Nope.
Okay. I don't see anybody in the attendance either, so there's no comments coming from the audience. Okay, Matt, as far as getting this, I seem to recall also we were looking at trying to figure out a way to get this out in something that the public can take a look at. Maybe we should revisit this in like the January timeframe to figure out if there's a static image that we can show or something that we can give that starts to put this data out there. Maybe just a PDF file or something like that that just kind of shows those kind of things. What do you think?
Before our town website upgrade, we were very close to actually. It's just a spreadsheet that's built, and so that was going to be embedded into a web page on the Board of Health because we didn't have anything else web page at the time. So I think we can revisit that at some point.
Okay.
That's part of the benefit is that it's stored already on town data storage. So our IT department was kind of said, that should be no problem. Slap it up there. Then that way it's live, so you don't have any updating issues of a PDF and having to constantly upload it.
Fair. So, yeah. As long as it's a one-way pipe and you can't like go in and start changing information that's on it.
Yeah. It's just interactive, but not edit element embedded in the web page. But like I said, that was before the website transition, and then obviously our IT department was focused on the entire web redesign for the town, and so we just have to kind of bring it up again and start exploring that, I think.
Yeah. Okay. Fair enough.
And I guess my only other question is while we're late in the window of recommended vaccination time, is it too late to get another clinic? Is it worth trying to get another clinic? Last year, we effectively ended the season with 31% of people vaccinated for COVID and 51% for influenza. And so just seeing these numbers we are like a far cry away from that. Is there anything do you think we can do, whether it's another clinic or anything else, to say it's not too late? I mean, yes, ideally you get it by the end of October, but it's November. The holidays are still ahead of us, so
We could. So for clinic, we have to make sure that we get at least 40 people for it to be cost effective.
Okay.
And we can certainly put out messaging around the holidays a couple weeks ahead of time to see if we can spark interest.
Do we want to try one before the Christmas holidays, like 2 weeks before the Christmas holidays, to see if that's possible? Or
we could try. It's just a question of if we post something and then we ask people to sign up and we don't get enough signups, but we get some signups, then we tell people who are waiting that, oh, sorry, we can't do a clinic now.
How much lead time do you need to get something scheduled and staffed and everything?
Probably 1 week to discuss internally and then 3 weeks of kind of notice.
Okay.
So it would be the decision right now to kind of get it so that way they could go forward and do something for like that in December. It's kind of a now thing.
Yeah, I mean, we typically start planning at the beginning of summer, and I'll get all our ducks lined up because people want stuff early, so we get in early. Because when you're working with the pharmacist, they can go to other places. So
Yeah.
we get
So
the
if we're
come in.
so if we lit a fire under Francis's butt tonight, so that would be next week is his week to discuss internally. The following week after that is Thanksgiving week, so the number of people that are going to be around are next to zero. And then you've got the 2 weeks, then you would ideally want it somewhere that week of December 8th to the 12th, maybe not any later than, and then, like that, because then that gives you 2 weeks to kind of get full immunity before the 25th. So we're about a week and a half too late.
I think that's too. I think that's too far out. I would rather be done. My point is, kind of like nowish, because you're going to at least get wrapped up before Thanksgiving a little bit. So I wonder if do we put out a communication? Do we state, here are our numbers for the town, and they're kind of concerningly low. And I know there are lots of people that believe that herd immunity helps us all, but 12% doesn't get you anything. And just kind of a communication that it's not too late. Vaccines are readily available at local pharmacies. The season is launched. Most likely, if you have Massachusetts-based health insurance, you're going to be, well, for sure, if you have Massachusetts-based health insurance, it's going to be covered, so it's not a cost issue. I don't know. Do you think that would be helpful to get a communication out? Say, these were our numbers last year, these are our numbers this year.
So we could do like a PSA focusing on the upcoming holidays.
Yeah.
Easy
I
enough
think that makes sense. Dan, what do you think?
Sorry, trying to find the mute button. Yeah, I think just messaging at this point is it's available, it's out there. We've run 2 clinics. I think trying to run a third is too much of a gamble as far as cost effectiveness. Messaging.
Okay. Make it so. Messaging.
Will do.
Engage. Sorry. All right. I guess that is where we are for that. Thank you, Matt, for the lovely update. Gosh, I wish our numbers were higher. It would certainly help an awful lot of people in our town. So everybody that's willing to go out and talk to your medical providers and set things up, please go do. You can always also just go to any of the local pharmacies in town. CVS definitely has it. I just went and looked on their website, and there's plenty of places to go get it and all that other kind of good stuff. And so, yay, go get it.
The one additional thing I forgot is we might try to include more vaccines next year. We were talking about like RSV. So that might attract more people as well.
So like shingles and pneumonia and all those other fun things.
Yeah, so we branch out into nursing and make broader connections. We'll try to expand everything.
Yeah, that would be helpful. I just went and got my first shingle shot. They say the second one's fun. Okay. I think that's a great idea.
Since you brought it up, our RSV vaccinations for Littleton are 14% of eligible.
Well, there we go. And the RSV vaccinations are for those people over 60?
50 to 74 is the category.
50 to 74. Okay.
And they say it's ever vaccinated. So that's an all-time count. Obviously a slightly changing population group year to year, but it keeps track, I assume, of a longer period.
And then is it also RSV for the younglings as well?
That I don't know. I'll have to figure out if I can get that by town.
Okay. But I thought there was also a younglings, like in like a lower thing. I did read that there was a study that showed that the RSV vaccination was incredibly effective.
Correct. It's there is RSV infant vaccination. My point is, I don't think they give it to you by town.
Oh, I hear what you're saying.
So small. So there is a state level report of that vaccination. I'm not sure how helpful that is to us to report.
Yeah, agreed, because it starts identifying population and who has it and who doesn't. So I get it.
Yep.
But as somebody, I did read through that that article, the scientific article that came out showing the effectiveness, and it was really amazing, actually. It was like it had a 71% effective rate at preventing RSV, and then it was like in the low 80s, low to mid 80s, or something like that for keeping RSV related pneumonias and lower lung infections away. And then there was even higher rates. There was a 90 some, and I don't remember what that one was, but yeah, it was really cool. That was really good to see.
Nice.
And I think was it US or out of Europe? Does anybody remember? I forget. I forget where the study was, but it doesn't matter because it's the same vaccine, whether it's here or somewhere else. It's good data. All right. Well, look at that. We vamped long enough, and now it's 7:20. Unless somebody else has any other information they want to talk about the data. Anybody? Going once, going twice. So, okay. Okay, so for our next 7:20, it's to discuss the charter presentation that I gave. Okay, so this is kind of a summation of what it was. All right, so let's go back in time. I got an email that said, hey, come and present to the charter committee about what your board does. And I was like, oh, sure, I can go talk about that. And Francis was nice enough to point it out because it was one of those things that came up in like 30 seconds. And then they changed the day that they were having the meeting because I thought I had more time. And then I basically hopped in my car, went down, and quickly got us a stay to actually have a presentation, which was awesome of that committee. So I appreciate that. And so basically we had the presentation, and that's what is included in the packet, is basically the Board of Health information. We actually reached out to the Massachusetts Association of Boards of Health and got some information. All of this is basically what we wanted to show was that where the board gets created from and its legal authority and all that kind of good stuff. So they make sure that that's there. And then they talk about the different ways that the Supreme Judicial Court of Massachusetts has confirmed the Board of Health's authority. And then the legislative delegation of authority has delegated its authority for that to the local boards of health. And there's certain extent of the delegation varies with the sanitary code and other parts of primary enforcement agent as it's local. So lots of things. And then we went in and specifically talked about the Littleton Board of Health establishment, where it came from. And the Littleton Board of Health was established in 1903. We are one of the oldest boards. So round of applause for ourselves that we were established that far ago. Woo-hoo. And so with that, we talked about that. We talked about removed and at least one shall be a physician. I pointed out that we not only have a physician, but we also have a nurse elected to the board. So thank you for your service and all that kind of good stuff. We did that. Then in 1995, they moved from 3 members to 5, and I counted that in there as well. And we talked about the board has not having any issues. In fact, I was a write-in candidate and got elected, so that's always good. And then we also established the Board of Health with the Director of Health in a town meeting. So the town has prioritized how the town is working with our moving away from the Neshoba Board of Health, which is fine, and we have now our Director of Health. So we gave that a little history on there. I'm just flipping through the packet, by the way. And then we talked about the duties of the Board of Health, and there's a joke in there, but I'm going to keep going. There was like 4 or 5 slides about those duties, and we add that. And then we talked also about the typical Board of Health meeting, that we have meetings that are scheduled. We may not hold the 2 meetings a month, but we at least have on the schedule in case something needs to come up that we can do that. We talk about our Title V variances, our health enforcement variances. We have policy discussions. We do disease tracking. There's administrative and all that other kind of good stuff. And the meetings last between 1 and 3 hours. And then I had a whole bunch of references. So that is the basic gist of what happened. I think the Charter Commission um, is coming up with some recommendations about what the board should be. I am trying to follow what's going on, and apparently there's been some discussions about how that is happening. And then I also asked some people around town why we're looking at going with a charter instead of the form of open government. And really, what it is that it allows, instead of the town being ruled through bylaws and acceptances of bylaws, it's now ruled through the charter, and it allows more independence away from state regulations or something like that. I'm not sure. I'm not correctly saying that, but everybody listening, definitely want to get a handle on what that is. You should go attend the meetings of the charter committee. And it also looks like they are looking at our board being a hybrid board in the future, possibly, which means they want to help us by having someone be appointed as a medical doctor unless there's someone elected. Otherwise, it's the rest of everybody's elected. So that's kind of where it's at. Thoughts, questions? Go ahead, Dan.
Um, Other than it's a work in progress, we'll see what they come up with recommendations. Did they say what the motivation was to have a physician appointed to the board? I mean, I can certainly understand having a contract with the physician because obviously we need the school nurses should have pediatrician oversight for their standing orders and protocols. And, we certainly need physician oversight for our nursing department's practice and to have availability for physical assessments and some of those other physician or, advanced practice provider level responsibilities. But that seems more like a contract hire position than a board position, but maybe that's just me. Was there a mindset or anything to share?
I don't know. I hadn't gone and fully watched what was going on. I was having a conversation with a town member about that. And I really think, Dan, that would be an amazing thing to follow up with Betsy on. I can forward her her email address so that way you might be able to write something up about that and maybe address those concerns if you have strong feelings about it.
It's more of a question. I'm curious as to
I'm curious too.
that seems more like that's
you-
an employee contract position than a board position. But
Why don't I put something together since I have the contact with Betsy, or maybe you could put something together and get that. And yeah, we can talk about that. And as far as a contract position with it, I think that's really what it kind of comes down to. Yes, Matt.
I guess my question is, I hadn't grasped this fully. I what is happening that is driving change for this board of health, and why?
They are looking at the evaluation of all boards except for the select board and how they're set up. And I did reach out to Cheryl, our Massachusetts Boards of Health, Massachusetts State Boards of Health, and we're going to work with her. I just found this information out about 10 minutes before coming to the meeting as far as their recommendation and kind of go from there. I don't know what the recommendations are for any of the other boards. Usually, from when I was talking with Cheryl previously, they usually carve out the library trustees and the Board of Health, and everything else kind of goes into a appointed position from the select board.
So that is on the table to consider, to restructure how Littleton's Board of Health operates, to flip it to appointed instead of elected.
Hybrid, so elected and then appoint an appointed doctor.
Well, that's what the words could say right now, but so it's on the table that they're considering.
It's on the table.
To
It is.
transform that.
Yes. Which I think is not appropriate. It should be an elected position. And I stated as such during the meeting. So, more work to do.
I would say that I'm not completely against some sort of language that says that there needs to be some health professional. I don't necessarily have to say it's a physician, but if you remain as an elected board, I think we've probably had boards in the past that had absolutely no health background in its members. And so if you end up with a board of, just throwing it out there, septic engineers, are you guaranteeing that you have kind of that expertise? Obviously, it's different because we now actually have a health department who can make the recommendations, and we can look to it as like, oh, okay, we now have a source of expertise. In the past, that was Neshoba as a recommending body. But so I mean, I think it's warrants further discussion and questioning and kind of driving. And I sure hope that we have ample input into what these changes are, since we're the ones
Affected?
doing the work and
Yeah.
have been managing it. And I think we just have to be kind of careful. I'm a little surprised that kind of the state who mandates the health department or mandates the boards of health to operate and function in a certain way would then also allow it to become a body of unelected officials. But
So actually, in the law, as it states in the MGL, it says that it's either an elected body or an appointed body by the select board. So
I know.
But we
Yeah.
do have precedent since 1903.
Yeah.
So
And do we know how many statewide are one versus the other?
I can get that on you. I don't know.
I think that would be an interesting factoid.
I'm sure Charlotte Mass Association has it. I will share that when I was in Billerica, it's an appointed board, and it's been an appointed board over there for a very long time.
And what were your experiences while you were on that appointed board? Because I know you did that when you were over in Billerica.
Yeah, no, I certainly did not have any of the potentially concerning behaviors that come along with an appointed board occur.
Okay.
I will share what Cheryl, as the director of Mass Association, openly shares, that she is an advocate for elected over appointed, and the rationale from her perspective and what she shares during like the new board member orientations that they run, is that the challenge with an appointed board is that they are there basically at the will and whim of the select board, so that if as a board of health who has regulatory authority chooses to regulate in a way that the select board differs from, they can turn the entire board over with no oversight or change. So she is certainly an elected board proponent, because boards of health are one of the few organizations in a community that can actually enact regulation and with the force of law. That very few other boards and committees in a community can do that. So keeping that authority and that power as close to the regulated as possible, rather than having that passed through a select board.
And there are
how she shares in her concerns. So
yeah. And she expressed those concerns to me as well. And I'm glad you stated those, because that's remembering the conversation now a little bit more. So thank you for that feedback. Any other information or questions? The only thing I got was find out the number of appointed versus elected boards, and I'll send an email to Cheryl about that and get that information. And then we'll work on a reply to the board, to Betsy, about the contract with the doctor, which should be sufficient to answer questions, which is something that did. What's interesting is that when they removed at least one health professional from it in the 90s, the early 90s there, the reason why they did that, there was a doctor that was always on the board that was elected, and what happened is the person retired and moved away, so that they couldn't fill that position, and so they had a tough time getting a doctor to come into that in the 90s. So remove that language so that wasn't required. So it's interesting that they're looking at it saying, oh, and we're going to need to require that. So yeah, we have to figure out the appropriate words.
My own last question was just like, what are the next steps, and what does this board need to make sure we're staying on top of and communicating with? And
So I will reach out to Betsy again once, because I just found this information out from a local person, and we will say, hey, wait a second. If you're making decisions about that, that would be really nice to have feedback directly to the board instead of having to find out about it third hand. So that would be really nice. So I will give that feedback to Betsy.
thank you.
Yep. Okay. Well, according to our agenda, 7:30 is our next discussion point, and it's now 7:35. And the next item up for discussion is the Board of Health email addresses. Okay. So to bring some things up, apparently the select board had a conversation about the planning board had gone to the select board asking for email addresses, and the planning board through the select board denied the request and basically said, nope, that's what it is. You can't do that. It's kind of interesting that they did that. But then what happened is less than a week ago, on Friday, I believe it was, I received an email that I forwarded out through Francis to all of you guys, and I also forwarded it out to you guys, coming from our town administrator, that we are going to have our emails removed on this Friday. I immediately sent an email back discussing some of the problems that I saw about that, and asked that we have a 30-day opportunity to gather some facts and to present why it's such a bad idea not to have Littleton emails given to a board. So that's the first thing. I wanted to bring everybody up to speed on that. So before we discuss that, I also want to bring up to speed on everyone that I also reached out to the Massachusetts Open Meeting Department, and also the Massachusetts Records Department. Basically, the open meeting people said that they are concerned about making sure that everybody adheres to the open meeting laws, and pointed me to the records administrator or the archivist for Massachusetts, because that is probably where the biggest problem comes in from this, which is that every point of communication that is done within a town is considered to be a record that needs to be archived appropriately, and that every piece of communication needs to have that record. So specifically, those records need to have certain retention requirements, and those retention requirements outlast your elected time frame of 3 years. So the town administers those requirements for each of those things. So that way, if anybody in the town wanted to gather the information about a subject, they can go and FOIA, Freedom of Information Act request, and gather all of those records. And it is up, because of the town emails and things like that, those emails would be sent appropriately. Or gathered appropriately as the records, because they're in an archive that the town retains, and they have a retention period for those things. So that's number one. Number two, in the email from the town administrator, he suggested that we create a Board of Health combined email. And I reached out to Cheryl, since Cheryl is our wonderful contact with that. And I said, hey, Cheryl, given that we have been asked to do that, she said that idea is, quote, having a general email address for the Board of Health could result in open meeting law violations. If you're all responding to the same general email, you could easily get into a deliberation on this general email and would violate the open meeting law. Additionally, or usually, global email addresses are used by the public to contact the health department staff, i.e. health@littletonma.org. I'm adding that in. We already have that. About any questions or concerns they have. And then, as our director of health, he could reach out to the chair or the vice chair or any member and say, hey, we have this question, can you answer it? Having all emails combined into one puts the health director also in a difficult situation. So that was her comment regarding that immediately. So she thinks that is not a very good idea at all. Yes.
Yeah. So we already have that email account.
Yes.
Called BOH. It's existed for many, many years. So we definitely don't need a new one. You are correct. Not everybody has access to it. I have access to it because when we went through this account exchange stuff, I was the responsible party that took it over because I was monitoring some just completely unrelated stuff. But it's not really posted anywhere, I don't think.
Good.
And used because it's not really monitored. But I have access to it, and because we've changed our administrative support staff a couple of times, I'm guessing that nobody else actually has access to that anymore. But I do have access to the inbox. So good news, there's nothing in there that's sitting there that somebody has sent out to say, hey, why isn't the Board of Health responding to me? So that's the good news.
So again, Cheryl, being the awesome person that Cheryl is saying that is a wildly, radically awful idea to have. Now,
Yeah.
the general one, health@littletonma.org, which also exists, which goes to our director of health for the health department, is the appropriate thing to do, and
Correct.
it is publicized.
So if I can also take a minute and describe some other kind of features, is that these accounts are not just email. So these accounts come with space for our document storage. So the infectious disease decision support tool, for example, resides on that system.
Yep.
The owner of that document is the BOH account. And that's why I wanted to keep the BOH account, because it becomes the master. So no matter who the board members are, we never have to worry about, when Matt leaves the board, how am I going to make sure we don't lose that data that he has? So the data store is all owned by the BOH account, and then we are all given access to it so that as we do our edits or whatnot, that's tracked in there. So this was not totally without design or thought, just to give you some of that background, because I know some of you weren't even here then potentially and weren't involved.
That's great. And also, I'm going to ask you for some more historical stuff in a minute, but what I also want to do, since we're on the topic of sharing documents on the OneDrive that's there, I view that as an incredible resource, so that doesn't actually occupy additional space in an email. We can say, hey, here is the link to go look at this document. Please remind people, do not make any changes, do not look at it, because then it becomes a discussion. But at least it gives you a central location to get at the information, to read ahead, to be that informed member on the Board of Health.
Correct. So what we said is that you're right. You have to make sure you're not having a conversation or debate about something in that electronic document that's not publicly available, even though, because it's on a town resource, it's not hiding. So there's that kind of level of safety of going like, well, we're not doing this in our offline system.
Yeah.
So
I'll get to that in a second.
What we would do is, for example, for the minutes, when we were following that process, and again, before we had turnover of multiple administrative support staff, I would love to get back to that.
Yep.
The rule was you could only point out an error, for example, like this is wrong or should say this, or put in a note that says something along the lines of this needs further discussion.
Yep.
So then we would present that document live during the meeting. Curtains are pulled back. This is what we're talking about, and then drive the discussion in a group to kind of make sure we're following that line of we're not creating a discussion, because you don't want to see a bunch of comments in the document saying, well, I think this, well, Kevin thinks this, well, Dan thinks this. Like, nope, not allowed, not how we're using the resource. And to your point, that offline review piece. If you are doing document editing, like our minutes that need to be updated all the time, or you're sending a document out for review and feedback, I think it's much easier to manage that one central electronic document and not put the job on somebody else to say, you're about to get 5 copies of this document emailed back to you. Just go ahead and cobble that together real quick. I'm confident you can do that in a short amount of time.
So to pile on to what you were saying, when I created that review for the Board of Health for the Charter Committee, I actually went in and, created that and then put it up on the OneDrive. And I said, here, Francis, here's the presentation. So if you ever have to give it away, it's in the administrative, in the section, it's all stored. All the versions are there. It's all version controlled and you can see everything. So it's beautiful.
No, it's come up several times and just historical, like the original budget that we set up for the health department and the job descriptions that we were working on, like those resources to have those someplace where it's the right version, it's the most recent. You're not digging through your email for some random copy of something. It's an invaluable resource that we have.
Working and so this is the other thing. As chairs move from one job position to the next position, you also have the ability to go look at information and search for it, and not have to bother the director of health to go get information unless you've put in the time to go search for it. So that way he can go about his inspections. So, yes, there's all kinds of things. Now, one of the things that was interesting that was pointed out to me was also that this email could be set up, according to the town administrator, to set up to email all of us at the same time. Well, so at least if it was FOIA'd, it would say, oh, look, this person had this email address to go out to there. But that doesn't mean that the other person is prevented from responding or even deleting that email. Because if they then sent a private email to, member number 7, that email then is FOIAble, because if they're requesting this, you have no knowledge. All you saw was that the email was sent out. Now you need to go ask for everybody and their private email addresses or whatever they choose to set up, to then go and say, hey, did you send an email to this person and have a discussion? Did you send it to these people and have a discussion? Because then the liability that happens at that point shifts, according to the archivist from Massachusetts, shifts from the town's liability to your individual liability. And now you have a potential of being in violation of an open meeting law. So now you need an attorney and you need to go defend yourself for all of that loveliness. So we got that email and I sent something back saying that this is unacceptable and all that kind of good stuff and asked for a 30-day extension. And then we got another email back today in which he basically pointed out that the email was only for the transition from the Neshoba Boards of Health. There it is, Matt Wason. So, Matt Wason, could you please give us a brief history on why we asked for email addresses and access to Microsoft Office services from the town? Because he was just saying it was for the transition, and now that we have a director of health.
Yeah, okay. So our current town administrator was our town administrator at the time. So Just put that off. So no, it has nothing to do with any sort of transition. All the stuff we already listed. We don't want to be using personal email accounts to have conversations about Board of Health issues for the town of Littleton. It just seems irresponsible in this day and age. Two, we want to be able to, have access to share data. So we're, again, not sending documents back and forth and making administrative support staff hammer through repeated changes of documents. Done. We had the full support of the town administrator at the time. IT department said not anything along the lines of, well, this is only temporary. Well, nobody else does it. It was pretty much nobody ever asks for this. So there didn't seem to be any barriers to it.
Right. Okay. So thank you for the back history on that. I will summarize that in an email response to the town administrator about that. His next statement, which I'm going to have fun with, was that additionally, by establishing an email for the Board of Health with other boards and committees, we feel it is important to be consistent with other boards' email assignments for equitable reasons. So if they're denying one, they're going to deny all. And oh, by the way, the cost is $31.80 per user per month, which I want to have a breakdown of what is actually included in that, because that is higher than the negotiated rate with the state or any MSRP that I saw out there. The MSRP, since we're using Microsoft Office for government, those prices range, the platinum, the best version that you can get out there that includes all kinds of things that the town shouldn't need, is really quite less expensive than the 31 whatever. So, but anyway, Doing some simple math, I rounded up to 32, so we didn't have to worry about dollars and the cent side so much. So 32 times 5 email addresses, since there are 5 members, times 12 months comes to $1,920 or so. So for a mere low price of less than $2,000, they're squabbling over our ability to now address all of those issues that we came up before. So that's for that.
I don't recall the cost. That seems high based on, because we did talk about it way back when, and like I said, the town administrator at the time did not have any qualms with it. It didn't seem that seems high, but like I said, this is years ago.
Yeah,
so I don't have a recollection of what it was, and maybe costs have changed over time. But I'm also
there's a greater than
the fact that if everybody asks for it, then yeah, I think you should have some conversation about what should be done. I'm a little annoyed here that there hasn't been any conversation. I'm learning so much from you presenting this tonight that I didn't get from this kind of random email that just says you're losing your account that we established, followed all the proper channels, got set up, and we are not a board underneath the select board.
Correct.
And so I'm kind of just struggling with how that decision just gets arbitrarily made and not communicated to us. So I'm hoping that instead of a 30-day stay on execution, that this is just set to indefinite until we can actually have some reasonable conversation and discussion that's put forward in a kind of respectful manner. So
yeah, and then his next point to that was also cyber. So I'm just going to lay it out there. I'm kind of a cybersecurity researcher. It's kind of the things that I do for like my day is I kind of like advise a whole bunch of people about cybersecurity, and the company that I happen to work for like sits on NIST that comes up with the way the federal government, state and local governments, deal with cybersecurity issues. So to flaunt that in front of my face is kind of interesting. So just as an aside, one of the town members also pointed out that in that $32, there's also a $15 or $14 per user fee for endpoint protection. And I don't know about you, but I don't have a town laptop, and I don't think Matt or any of the board members have a town-owned device. So we're all going through Microsoft, and Microsoft has all of the cybersecurity stuff. So why are we paying the additional money for endpoint protection when none of us have an endpoint? Fun. Also, I know all of us have to go do our cybersecurity training, so please make sure you're up on to date on your cybersecurity training. One of the other things that I pointed out was that I have to go through extensive cybersecurity training for all of the things that I work on and do. I volunteered to give my certificates of completion that I have to do multiple times a year to the town so they could save money on the know before you whatever training that they have. And they refused have the certificate count. So they require me, even as a professional in the cybersecurity arena, to go through the same training that everybody does, even though it's a repeat on what I'm actually doing for the DOW or any of the other things. So that's fun.
I'm not crying for you. But yeah, so people who are listening, paying attention, yes, as a part of having the town account, we are required to then go through the expected cybersecurity and safety trainings on all of those items so that we can make sure we're operating in a safe manner. Our risk is exceedingly low because, like you pointed out, we don't have any devices. We have email accounts.
Yep.
So if we were to botch something with our town email account, we'd be hurting our own personal device. Mm-hmm. And the access that anybody outside would be getting is our Board of Health email address and our open document storage. We don't have any access to town systems. We don't have it, like, you can't steal it from me because I don't have it to be stolen. So I consider our group risk quite low from that perspective.
Yeah, the endpoint exposure is extremely low. The other thing that was brought up, potential, was a risk to the OneDrive if you uploaded malicious content. I pointed out that uploading malicious content is scanned by Microsoft for the security levels. That is on a government system that should be turned on by default. So that way, if you put a malicious piece of content into a OneDrive or someplace that you're using up on those devices, that it is automatically scanned. And I know that happens because Microsoft for Government includes that, so that way you're not introducing malicious content on there. So that is an automated thing that's just turned on. And I think it takes several layers to actually turn that off. I don't think that's one of those things that you can turn off. So even from that perspective, I don't see that as an issue. So then he goes through a couple other things about accessing, and basically what he said is everybody could log into that same account and then access the Microsoft Office 365. But that is actually a hellaciously worse idea, because then you have 5 people and you have no way of auditing who the person is that went off and did that. And so that's an even worse approach to doing that. So yeah, that's not.
Yeah, I mean, there's some history of maybe somebody who used to be employed in the department that went and tried to delete a lot of files out of our OneDrive account. And had that just been a shared account, you wouldn't really have been able to see what user was doing that. But it was quite easy to see the tracking for that when I had to recover those files, which is quite easy. They were frankly in the recycle bin. But no, we specifically said we do not want just a single account trying to do that, because you then also, if you are doing some document noting, like on our minutes, if somebody asks for a correction, how do you know who to go back to and ask a simple question? So yes, we kind of debated that again years ago when we started to do this, and felt that just wasn't going to be like the smart choice longer term.
So let me understand, we already had an exposure of someone trying to go in and remove things, and there was a way of accounting so that if you knew who the individual and what had happened through that accounting, which is exactly what you should be able to do through some auditing records and things like that, which is perfect. So having access to a communal account and having everybody access to the Office 365 makes it so that no one is accountable, which is setting the town up for a huge exposure. So that's also a really bad idea. So basically, I'm going to draft an email response to them. I will also include Mark Rombacher, who is the Board of Health Select Board's interface. I will make sure that he's included in all those conversations. And so I would also encourage everybody that is on the board to reach out independently and communicate to the select board about those issues. Probably the biggest thing is individual liability. With that, basically one of the things that I pointed out was that by requiring us to use an independent or our own email address, basically you are now exposing yourself to an open meeting violation, which then what I would do is not allowed to have an email, which means then people will not be able to communicate directly with a member independently on the board, which is a horrific thing. It's just not okay. So, yeah, that would quell the ability to do work in a modern system in 2025. So, yeah, I think he's not really thinking through all of the things that he's anticipating. So I will reach out and do that, and we'll kind of go from there. Does anybody have any other comments? Dan, you've been...
I mean, the long story short is it's cost.
It's $2,000, really?
That's what. Well, I mean, but if it's, we've talked about this before. When we asked, and they went, "No one has ever had it." I thought school committee had, but I had addresses. I just looked; they don't now. But I thought when we actually had asked that the school select board and school committee already did when we asked.
So school committee has them through the Littleton school system. So yeah. So they have them.
They have town addresses, but not Littleton MA addresses, but they have town addresses.
Yes, so they have town addresses. The select board has a town address.
Town addresses.
And the library trustees have their emails through a library something trustee somewhere. So they have all of their retention things handled through all of those other systems, and FOIA protection and all that kind of good stuff. Whereas if we move away from that, we're assuming all of that liability at that point.
So basically, it's coming down to they want to be equal across. So we're an outlier, and cost. I would be curious to see if they remove the select board's email addresses, because certainly any discussion points they have around removing ours, I would think would apply exactly the same way to the select board. It's cost per user, it's access, it's concern, whatever list of concerns they have with a board of health having access to town email addresses. I would think those same concerns would exist for the select board.
Yeah.
So I'd be curious about that. And again, through the school department, Littleton Pub PS or whatever their addresses are,
Yeah,
they should
littletonps.org.
still be a town server, a town run address. So I would think the same thing should apply there. So I would love to see if they're going to be consistent, be consistent. And we can go back to, we'll joke to when I first started in the Billerica board. Now, 20 years ago, Ben was a tiny one when I started there, that we had our health agent drive around to each of our houses and deliver hard copies of the meeting packet and agenda for every meeting 2 days beforehand. Because that's how they were delivered, because that was the only way to deliver them, because we did not have email addresses and like town email addresses. So we didn't, and they did not want to send them out public because this is basically it's a meeting packet, but it's still internal communication until it's public. So it was done on paper, old school way. And I can't imagine Francis was going to want to drive around to all our houses every other week delivering big manila envelopes with packets. But maybe he does, add to his day, get out of the house.
You can have good snacks. Yeah.
Get snacks and stuff. We'll make cookies for you.
Healthy cookies, high fiber,
cookies,
low sugar.
I mean, if it's cost, I get it. I mean, even if it's $2,000 for us, how much the school committee is going to be similar. And I admit, I just glanced really quick until they take away our email addresses at the two lists. It looks like the charter committee, while some of them have their own email addresses from others, but it looks like most of the charter committee has town email addresses. Folks who are no longer in positions, so like former select board members and stuff who are not in positions but still have town email addresses. So if they're going to be consistent, then now that's a call that's town IT can make. They can not offer that service anymore. But I would just love to see it be consistent across the board. If they were actually going to do that, if the rationale is a legitimate concern, then it should go from the chair of the select board all the way down to shade tree committee members or whoever.
And not
that there's anything wrong with shade tree committee. I'm just using them as
and have discussion.
I mean, this is obvious. Like this is technology over time, and if you don't adopt it, then people start to adopt it on their own. It happens in every environment, right? A tool comes out, you start using it, and if you don't get ahead of it, then you end up behind it. And I think this state, we're not the only town with this problem. I think the state is behind it now, because I think in this day and age, we're in 2025, right? How is this just not a mandate that everything done by any elected official in this state is not under an account that the state is managing or is delegated management to the town, so that you're protecting everything from this? And that's the bummer, is that, right? Like, most people don't know. Most people haven't researched this. I was quite stunned when I got appointed to this board and discovered that, just use whatever Gmail account you want. Like, wait, what? It just flies in the face of all of the other kind of regulations and mandates that we're supposed to be following, to then just kind of have this hole at the end. But like I said, we're not the only town. I'm sure it's problem across the board. So I would love, hopefully it's not one of those, like, we point around and be like, see, nobody else does it. Well, yeah, we're all in the same boat. We just have closed our eyes and stuck our heads in the sand a little bit. So thank you for following up on this. My key question is, do we have a stay? I haven't seen a communication. Am I losing this Friday?
I am basically saying, coming out of this, that after our discussion, that the board is not in favor of having our emails removed, and that we need to have a face-to-face discussion on the merits of why you believe that it is a appropriate thing to do, besides cost and besides fairness, because that
Yeah.
no.
So I need the plan given to me by the managers of the systems as to what they want me to do with my archive records. Because if I just download them all, because I'm going to lose access to all of my emails and my documents. So I'm going to lose my ID decision support tool, which has years of data stored in it now. Okay. And am I supposed to just copy that onto my computer myself? Like, what's the transition plan for that kind of thing, and how am I going to make sure I still have that? Like, what is their plan? You know what I mean? So it's not our board to try to figure out what we're going to do with that. So what is their recommendation? Are they saving my emails so that those are all public records still? But is there a recommended way that I'm supposed to retain access to those, that I'm not the only keeper of, right? Because
it's actually the town's responsibility to do that, but because it's the town's email. But then once it transitions to our private email, if you start sending and receiving things,
sure, from then on.
Yeah, exactly.
But then, like I said, those documents. I mean, do we all each individually download documents? Like, what's the plan for that kind of thing? So I would really like to get some guidance on any of that before we lose any access whatsoever.
Yep. Okay. Any other items for discussion on the Board of Health emails? Nothing. Going once, going twice. Okay, it's now 8:07, and our next to last item up for discussion is 7:35 update on the opioid fund settlement. So, Francis, take it away.
Sure. So in the pack, you'll see we finally executed an IMA. This will allow us to pool any monies we want to use together as a region. We have done that, and now we're actually going for a grant already through the Mosaic Rise group. It's for $96,000. It would go towards counseling coaches. So we're putting that together right now, and we hope it passes.
Sorry, I was muted. When did this agreement get signed?
Middle of October.
Middle of October? Okay. All right. Matt, you had a question?
Can you give us a 2-minute on how the IMA group is coming together, operating, making like a key decision like you just mentioned?
Yeah, it's small right now. The intent through the IMA is to get some kind of advisory board set up, maybe sometime after this winter, where each town would have 2 representatives, a primary and a secondary, that would be part of a board deciding how to spend funds and what activities, and if we have stuff in the works, evaluating that programming, determining where to go from there, stuff like that. Cool. So we're still in the organization phase.
Okay, and it looks like we've got Littleton, Harvard, Air, Bolton, Groton, Shirley, and Pepperell. And it looks like it was executed by the Select Board of Town of Littleton. Okay. Awesome. All right. Does anybody else have any other questions on that? So we have organization, when it's going to meet, it's getting started. It was just signed. Thank you for letting us know.
I think it's going to be a great thing. A lot of grants right now, because there's so little, is geared towards regional efforts. So it definitely gives us a leg up. And it's really needed in the region. And it's good to have it basically all our bordering neighbors, essentially. So programming in the region will have all the same message, which is good as well.
Awesome. Really appreciate that. Thank you so much for doing that. Any other comments before we move on to our next item of business? Okay. Hearing nothing else, thank you for that. We're going to take care of the 7:55. It is now 8:10. We're now going to go to the 7:55 correspondence. So before we do that, could we have a quick discussion, since it's administrative and kind of correspondence time, about our meeting schedule for this month of November, and then also for December and potentially for January? I want to make sure that we're avoiding all of the seasons of holiday and cheer, and make sure that we are setting the meetings appropriately. So we have today, November the 12th.
Yeah, Kevin, if I can jump in and give some already. So we kept
sure.
12th. We're going to skip 26th. We debated slightly about switching weeks so that we could still have another meeting if it felt like demand. Otherwise, December 10th is our normal time. We'll keep it. December 24th is our normal time. We will cancel it. And then January, going back to 2nd and 4th, we had to be to the 14th of January. So we would be dodging the beginning of the year holidays there pretty well.
Excellent. Okay, so it was the 14th and then the 28th?
That'd be 2nd and 4th. So that would be on our normal cadence.
All right, perfect. And I assume you had talked about that last month.
Yeah, it was more just that we tried to switch it to like this 1st and 3rd for November and December, but we didn't, and we're already on 2nd and 4th. So unless we needed to rapidly adjust that for December, we could switch from just the 10th to the 3rd plus 17th. I think that could still be an option for December if we wanted to.
Yeah.
Like I said,
are we seeing
I feel like it should be based upon demand.
I was going to say, are we seeing a demand curve, Francis, for the 2 meetings in December, or nothing yet? Because we should start to see a demand for that.
We haven't had anything yet, but I might as well, Kevin, as you know, my announcement. We got so caught up in tobacco regulation, I forgot to mention at the last meeting. My wife is due at the beginning of December, so I will be out for a couple weeks. You're welcome to have a meeting, obviously, but I don't, just in case that changes anything.
You'll be busy. I propose we keep the standing schedule, have a meeting on the 10th if we have agenda items.
Yeah, go ahead, Dan.
Oh, I was just saying, I hate bringing it up, but someone's going to ask, who's your backup while you're out?
So the Concord Health Department has agreed to be our backup while I'm out.
Awesome. Sorry. Thank you. I just, because somebody left, as we well know.
Yeah, I was sworn to secrecy and held that in so hard. I've been wanting to say something, so I appreciate that I've now been deceived of that secrecy. The NDA is now ripped up. No, I'm just kidding. Congratulations, family first. Do all the right thing. Enjoy.
We'll see.
Okay. Thank you for the backup. So thank you for letting us know that Concord is there. I assume that when you're out, just let me know or Heidi know, and I guess we'll start going through Heidi to work through that and to get that taken care of. So Heidi, I'm going to become your new best friend.
Yeah.
Okay, so that's all good. And then Francis, if you wouldn't mind sharing out to me the Concord email and contact information, so that way maybe you and I could have a meeting with a Concord person to kind of say, hey, this is Kevin. He is blah, 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 blah. So you might want to set something up so that way at least we have those electronic introductions in a more Zoomish fashion.
Yeah, of course.
Okay. Matt, would you like to be included in that since you're the vice chair?
Sure.
Okay. We're allowed to do that because then it's not a meeting. Okay. So, all right. So I don't need that. We covered that. That's taken care of. Okay. Correspondence, comments and public input. Let's see. There's nobody in attendance this evening for our public input. So boo, but okay. Correspondence. Did anybody receive any correspondence from anybody? Going once, going twice.
Francis sent out since our last meeting the MPOX advisory, just so that we're aware. So I'll briefly throw out some of those details because I have it in front of me. As of October 1st, there have been 34 MPOX cases reported in 2025. And that's
Massachusetts or nationwide?
That's from this fall. This is Massachusetts.
Oh, okay.
Yeah. So it's as they say, small compared to the peak of the global outbreak in 2022. Okay. But this was sent out just because it was from August 1st to October 1st. So okay. that is a short period of time.
That's a short period of time for a large number.
Right. Number of cases to be coming out in that case. And it just details about exactly what it is. But so there is that announcement that came out. And so it's just make sure it's considered by the clinicians who are potentially seeing patients with these. And there is a vaccination and post-exposure that you can get for that. And then the other one I hadn't looked at, Francis, was do you want to talk about the CareSolis data?
So I just got that. I haven't read through it fully. I just kind of skimmed it. But I thought it was interesting data to look at further.
Could we have a little background on the CareSolis data, what it is for?
Sure. So it's basically a referral line. Up until last year, we had something James Network. I'm drawing a blank. But essentially, we had a referral service before. It was costing too much money. And we found CareSolis, the EHS did, which was a little cheaper, and they seem to provide more data to the towns. So this is currently who we use for mental health referral services.
Got it. Okay.
And the data kind of talks about how they connect people to care, what the timelines are for certain services, and talks about data from Littleton versus the state, different trends.
Okay.
And I just point out the two that were the most interesting.
Okay. All right, that's good to know. The other thing that I also
before you jump on, is that something? This said October. Is that a monthly report that they're going to be putting out then?
I believe so. Yes.
So okay.
This is the first one we got. Yeah.
Thank you.
Okay. Those are always good numbers to also to kind of have in our back pocket, so we can start to see if there are any trends or things like that we need to start messaging. So, okay. The other thing that I wanted to bring up, near and dear to my heart a little bit, is food insecurity and stuff. So I asked Francis, with things that are going on nationally, to worry about the factual information surrounding getting people food that are needed in our communities. So I wanted to make sure that people understood that there is a food bank out at Devon's, Loaves and Fishes, and there's other food banks around. Francis put some information together on the website, and also in our meeting packet, there is some information about food pantries and resources for the Littleton residents. So please, if anybody's out there and needs specific information, please reach out to our director of health or anybody at the office. This information is there and it is also on our website, if I am correct. Is that correct, Francis?
Yes, it is out there.
Okay. So, again, please go reach out. Don't hesitate, is basically what I'm saying. So, okay. Anybody else have any other follow-up information on that? No? Okay. So, Francis, thank you for putting that together. The information in the packet, it looks amazing, well thought out and well put together. So thank you so much for doing that. That's absolutely amazing. So, thank you. Okay. Does anybody else have anything else that they'd like to share? Is there a national holiday or something like that, Dan, that we need to know about? No? Come on.
Nothing for tonight. Sorry.
As a side note and funness, go outside tonight. You might see the aurora. If you didn't notice last night, that only got up to a 7. Tonight around 9:30 or 10 o'clock. I'm not having the meeting wait until then to go out and do that and show you that. But around 9:30 or 10 o'clock, it's supposed to reach the maximum of this G4 wave that came out of the sun. It's supposed to be around 9 tonight, which is going to be hopefully some amazing colors of reds and greens. For those of us that are red-green challenged, when I walk outside, I really can't see very much, so I need to use a phone to take a look at it. So those of us that are red-green challenged, you can still see it, use your phone. And so that is always fun. And try to get to a place that doesn't have a lot of light pollution. You'll get even better results. So again, go outside and have some fun, get a little cold, crisp air in those lungs and look up to the heavens and see if there's a show. All right. Does anybody else have anything else? Nothing? Okay. I need a motion.
Make a motion to adjourn.
I have a motion to adjourn. Do I have a second?
I'll second.
I have a motion and a second. Roll call vote. Matt Wason.
Matt Wason, yes.
Dan Kane.
Dan Kane votes yes.
Kevin Davis, the chair, votes yes. That was our only vote tonight.
And it was unanimous. Great job, everybody.
Look at this.
Yeah.